So at the first office visit, you'll come in to be registered. We'll get various pieces of information so that we can get to know you better. Then the doctor will perform an examination and ask questions, and we'll also review the x-rays or any other radiographic studies. In general, if people have already exhausted non-operative measures, then we talk about surgical options, which would be either hip or knee replacement.
These are the best operations in orthopedics. Some of the best operations, that are performed in any field across the spectrum in terms of, how many patients are affected by these problems, how severe their pain and disability is, and how effective and predictably you can dramatically improve their quality of life. It's pretty awesome. You can do an operation that takes less than an hour and take somebody who's been pretty miserable, in some cases for years, in some cases even longer, and have them realize what their new life is like a pretty short period after getting through this operation.
In order to be at the highest level, you really need to do a relatively high volume. We actually do close to 1,500 joint replacements per year. You need to see all the hard things and see the easy things and have a lot of opportunity to have different types of patients come through the program. It allows us also to assess quality measures and outcomes quite a bit better. It's very difficult to know what outcome you have if you're just doing 20 or 30 a year. You really need several hundred to see little differences in what we can make better. So I really feel blessed to be able to be a part of the program here.
There is a whole system that you need in order to be able to execute surgeries safely, successfully, and at the same time efficiently with the volume. You need to have staff that understand the way to do the operation safely and efficiently. You need to have hospital administration who gives you the resources that allows us to be able to fill a day with 7 or 8 surgeries. It's not anything extra we're doing. It's just standard. It's routine. There's no real trying to think or figure it out. Once you've kind of gotten to that phase of comfort with it, it's really just giving you information. It's giving you a powerful tool that allows you to do things more precisely, to perhaps do things you couldn't do with the more conventional technique. You plan the surgery, you execute it, and then you look at your result both on the knee that you're looking at and the picture in your x-ray, and they're exactly what everybody expects. And so, patients they're so happy, people will hug you, a kiss on the cheek. Sometimes people are crying because they're that happy with what their new life is like.